Hello everybody and welcome to our lesson on muscles of the shoulder joint. So this is a first in our series of recordings looking at the different muscle groups, and we're starting with the shoulder girdle. So by the end of this session you're going to hopefully show a knowledge of the anterior, the front skeletal muscles and joints that they cross, and also some of the posterior skeletal muscles and the joints that they cross. And this is just the beginning, the first of a number of videos on them. So I've just put in a couple of slides for a quick recap on muscle actions, which I'm sure you remember, but just in case you don't, just to remind you of some of the level 2 learning you will have done, that this is the same for all muscles. Muscles can only pull, they can't push. They create an action on the joints that they cross. So we always have to know what joints they cross. They work in pairs and they can only work along the line of their fibers. So those four are really important to bear in mind all the time. And again, just another recap of the different roles that muscles can have. So a muscle that does the main movement is called the prime mover. So that's the main movement. Obviously for a biceps curl, for example, it would be the biceps. The antagonist is the muscle opposite. We've said that they work in pairs. And so for a biceps curl, the antagonist would be the triceps. The synergist, and we come across this word a fair bit when we look at the different muscles coming up, is a muscle that assists the prime mover. So it's like a helper. And then finally, the fixator is a muscle that it does what it says on the tin. It helps to fix or stabilize a part of the body whilst another part of the body is moving. So here we go. So we've got about 650 muscles in our body, and you'll be really relieved to know that we're actually only going to learn about 50 of them. You did 20 at a level 2, but we do about 50 at level 3. And this can seem quite daunting because it is one of the most technically complex parts of the course, learning these muscles. But it's so important if you're going to be able to write effective and safe programs for your clients. So it's really, really worth every minute you spend learning these muscles and getting a really clear picture of where they are, what they do. So we've got 3 different kinds of muscles in our body. We've got our cardiac muscle, which is to do with our heart. We've got our smooth muscle. That's our involuntary muscle that we've got in areas of our gut. And we've also got our skeletal or our voluntary muscles. And this is what we're starting to look at now. So when we think of muscles, often the name itself gives us a clue about the muscle. And sometimes this can be the shape of the muscle. And that's the case here with trapezius, because it's a trapezoid, I believe, shape. Please don't tell me off if it isn't, but trapezius tells us about the shape of this muscle. And it's kind of a kite-shaped muscle that, as you can see, goes right from the base of the skull across the top of the scapulae and down the spine to where the base of the ribs are. So it's got, you can see how I said muscles only work along the lines of their fibers. And this muscle, the trapezius, has got 3 different levels of fibers. So at the top, the origin, where it starts, comes in the back of the skull, attaches to C7, that's your lowest cervical vertebrae, and all the thoracic vertebrae. Sorry, that's not just the upper fibers, that's the whole muscle. But the upper fibers you can see from the back of the skull across the top of the scapulae, and they work to elevate, to lift up the shoulder girdle. The middle fibers that attach along the spine of the scapula and the lateral edge of the clavicle work to retract, draw those shoulders back. And then the lower part, where they're attached down through your thoracic vertebrae, depress, push your shoulder girdle down and draw them back and in. So the whole of the trapezius muscle upwardly rotates the scapula. So that's where the base of the scapula is going up and out. And this muscle works as a synergist, as a helper with serratus anterior. So that's your trapezius. Now, again, the name of this muscle, rhomboids, helps to describe the shape of the muscle very accurately. Because remember, I don't know if you remember from your maths, but a rhomboid is like a rectangle that's been kind of pushed over to one side. And that's what the rhomboids look like here. So they're basically the muscles between the inner border of your shoulder girdle, and they draw your shoulder girdle back, your rhomboids here. So let's go through, look at the origin. So the origin where it starts, the spinous processes of your cervical and thoracic vertebrae. So from C7 and T1 to T5, all the way down you can see, and then it inserts onto the medial, which is the inner border of the scapula. So this is where all your knowledge of this anatomical terminology really, really helps. Now, joints crossed, it says it crosses the shoulder girdle, and it moves the scapula relative to the rib cage. That's that scapulothoracic joint, if you like. Joint actions, you can see if those fibers pull along the lines of the fiber, they're going to retract the scapula, and this also downwardly rotates the scapula. So that bottom border, the inferior angle, will be drawn down and in. And it also works with the muscle pectoralis minor as a synergist. Those are your rhomboids. Levator scapulae, again, does what it says on the tin, elevates your scapulae. So this attaches, it starts at the transverse, so the spines that stick out to the side, transverse processes of your cervical vertebrae, just 1 to 4, and then it goes into the medial aspect of your scapula. Now, it's worth having a look at different anatomy books to see these muscles, because you get different angles and you can see them more clearly. But this is your levator scapulae, and it basically goes onto the upper medial border of your scapula. Joints crossed across again. This is all shoulder girdle, and you can see how it would elevate, lift up the scapulae. Now it says if the origin is fixed, so that means if your head is fixed, it's going to lift up the scapulae. It assists in the downward rotation of the scapula, that inferior border coming down and in, and it also laterally flexes the neck, like that. And that's if the scapula's fixed this time. So if the scapula's fixed, it takes the head down. Next, we have your serratus anterior. Now, sometimes people can confuse this with some of the oblique muscles, but these are much higher up, and they're like finger-like projections that come around your chest wall, and you can see kind of the finger-like ends of them that wrap around to your ribs. So they start the front of the ribs, from your first to your 8th rib, and that inserts, it goes around the back of your ribs, inserts on the medial border of the scapula. Again, shoulder girdle, moving the scapula relative to the rib cage. So it's the interaction between the two there. Serratus works to protract the scapula, and it upwardly rotates it, again working with the trapezius like we heard in the first slide. So serratus anterior, just think of those finger-like projections coming round the chest, protracting your scapula. Okay, pectoralis minor. So you'll know that you have your pectoralis major, but this is a smaller muscle, pectoralis minor, and can often be tight in people who end up doing a lot of computer work, things like that. So again, this starts, its origin is in the front of the ribs, 3 to 5, and then it attaches into what's called the coracoid process of the scapula. So the scapula comes up and over, and we've got those three bits that we need to remember. We've got our acromion that's at the top that sits over the head of the humerus, the glenoid cavity, which is the articular surface the head of the humerus articulates with, funnily enough, and then this bit coming out the front that you can just feel if you press into the little sort of shallow bit underneath your clavicle there. That's called your coracoid process, and it's an attachment point for lots of different things, but particularly pectoralis minor. Again, it's a shoulder girdle muscle, and it also protracts the scapula, pulling it forward. You can see how it would do that if it pulls down the line of its fibers. Downwardly rotates the scapula, working as a synergist, so a helper with those rhomboid muscles. And during breathing, when the ribs are fixed, imagine you've got your hands down, it elevates the rib cage, so it can help when you're needing to get extra breath. And people, imagine leaning on a wall. You've been for a long run, you lean on a wall, so your ribs are fixed, and then the pec minor helps to elevate the rib cage during breathing. So those are all the muscles that you need to know for your the shoulder girdle muscles. So if you prefer to just have a look at the PowerPoint without me talking over it all the time, and just go over and over and over till you feel really confident with those muscles. Okay, thanks for listening.